Thank you, Arlene. That's all for Bronx Updates. May is National Stroke Awareness Month. Each year in the United States, approximately 795,000 people have a new or recurrent stroke. Every 40 seconds, someone suffers a stroke, and every 4 minutes, someone dies of a stroke. Montefiore is the only medical center in the Bronx with a prestigious Advanced Comprehensive Stroke Center designation in Westchester County and the Bronx, seeking to serve our Bronx community by raising awareness about stroke identification, treatment, and prevention. Joining us now to give us stroke facts, identification tips, and helpful lifestyle changes is Dr. Charles Esenwa from the Montefiore Comprehensive Center for Stroke Care. Welcome, Doctor.
Thanks, Sanji. It's a pleasure to be here.
Thank you for joining us. So can you tell us first, starting off, what is a stroke?
So stroke affects the brain to start with, and most people may not realize that. And so I think everyone recognizes when somebody else is having a heart attack because the national sign of a heart attack is clenching of the chest. But there isn't one specific sign or symptom for stroke, and therefore people don't recognize that it's a problem that affects the brain. And so the brain, just to take a step back, controls who we are and how we move around space. And so if a part of the brain is not receiving blood, that part of the brain stops working and people start to have symptoms of a stroke. And before we go on to what those symptoms are, I wanted to mention that it's critically important for your audience and the Bronx community, Northern Manhattan, to understand that we are living in a hotbed of stroke incidents, meaning that people that live in New York City, and especially the Bronx, are at a 2 to 3 times higher risk of having stroke compared to the rest of the nation. Wow. And why is that? It might be poverty related, it might be the stress related to living in such a large city, but this is really important for our community to understand and to be able to react if they spot a symptom or a sign of a stroke.
Right. So now going into identifying a stroke, how can one tell that they're having a stroke or about to have a stroke?
Yeah, and that's, I think, the most important thing for our audience to know. And so, as I said, with a heart attack, it's chest pain. The equivalent of a stroke, or as some people like to refer to as a brain attack, can be remembered by using a mnemonic called Be Fast. And so Be Fast really spells out the 5 cardinal symptoms of stroke. And starting with the B, that's balance, so loss of balance. It would be the initial symptom of a stroke, or one of the symptoms of a stroke. Sudden onset loss of balance, trouble walking. These are the complaints that I sometimes get in the emergency room. E stands for eyes, and vision loss is one type of stroke symptom or sign. Blurry vision, and again, it's important for the audience to remember that it's sudden onset vision loss or blurry vision. F stands for face or facial droop, which is one of the most common signs of a stroke. A is arm or arm weakness, arm numbness. S stands for speech difficulty, meaning slurred speech or garbled speech. And finally, T stands for time to call 911. So really, it's be fast, and remembering the 5 cardinal symptoms of a stroke is critically important in stroke recognition.
Right. And there's also different types of strokes. Can you tell us about those?
Absolutely. So there are 3 different types of strokes, what we call subtypes of stroke. The majority of strokes are what are called ischemic strokes or dry strokes. This is when the artery that feeds that part of the brain has a blood clot lodged in the brain or in that artery. And that prevents blood from going to that part of the brain. That part of the brain starts to shut down and the symptoms of a stroke start. That accounts for about 85% of stroke types. The risk factors are typically diabetes or hypertension, which we'll talk about in a little bit. A hemorrhagic stroke, or the second type of stroke, accounts for about 10% of strokes. And this is when the blood vessels that feed the brain burst, and there's suddenly blood in the brain, causing that part of the brain not to work. And lastly, there is a TIA, which is mentioned here. And a TIA is called a mini stroke when a dry stroke starts to happen or a blood clot starts to block off the artery, but by the time the patient comes to emergency room, that clot breaks up and blood flow is restored. And we treat that with the same urgency as we do a ischemic stroke or an actual blockage. It tells us that that person is at major risk of having a big stroke, and therefore we take that very, very seriously. One other thing I'll mention, sometimes people develop sudden severe headache. They call it the worst headache of their life. That is also a potential stroke, and those types of strokes are called subarachnoid hemorrhages. Those are the ones that are associated with aneurysms. So when somebody has a balloon-like dilatation or abnormality of the blood vessel, that balloon-like abnormality can burst or rupture, causing, again, blood to flow into the brain where it shouldn't. And that patients typically present with sudden severe headache.
Right, okay. And what are some of the services that a patient can get at the Montefiore Comprehensive Health Center? I understand it's the only one in the Bronx?
Right, so as of 2018, we were designated a comprehensive stroke center. And that's the highest level of stroke care that any hospital in the US can provide. And therefore, we have ability to treat all sorts of really, really serious types of stroke. And so the Montefiore Comprehensive Center for Stroke is able to provide what's called TPA, or medical treatment, IV-related treatment for stroke within 4.5 hours of onset. Out to 24 hours, we can provide for certain subset of patients, we can provide a procedure, which is really a breakthrough procedure that's come about in the last 3 or 4 years, called a thrombectomy. And so people really that have a clot sitting in one of the major blood vessels of the brain, the TPA, or the medical treatment, usually doesn't break up the clot. The clot-busting medication is just not strong enough to break up such a big clot. And so what we have to do, and we have to do this right away, within minutes of presentation, is take the patient to this procedure where we go with a catheter and snake the catheter up to the brain and actually physically remove the clot with a catheter. And so a subset of our patients qualify for this, but ultimately, the most important thing that people can do is recognize a stroke and present to the hospital in a timely manner so that we can do our job to get that clot out and restore blood flow to the brain. And we're always amazed in the type of recovery patients have. Some patients live with a lifetime of disability, whereas others come in really, really sick and within 24 hours are restored to their normal function and are able to walk out of the hospital. And really the difference there is timing of presentation. And so as soon as patients recognize stroke, they have to call 911. It's time to call 911. If a bystander recognizes stroke symptoms, it's time to call 911 for the person that's having a stroke.
Thank you so much, Dr. Charles Esenwa, for joining us today and giving us some helpful stroke tips and more information.
Thank you, Sanji, for having me.
For more information on strokes, visit stroke.org or strokeassociation.org, and of course, Montefiore.org. We have to take a quick break. More open right after this.